All right, let's go.
So here we have a diagram, a visual mnemonic that reflects the 5 most common leukodystrophies. And this is based on the original Alexander in his van by the UK Neurology Residency program. So we'll talk through each of these 5 leukodystrophies, some of their imaging patterns, associated clinical signs, and associated genes. So first we have a van being driven by Alexander. We have a paint job in the middle of the van, a crab, and an adrenal gland towards the back. So these are going to reflect our 5 different leukodystrophies. First, we have the entire van, which represents Canavan disease. And Canavan's disease can affect the white matter throughout the entire brain. Now you can see that the van has headlights, which is reflecting Canavan's disease can cause a retinitis pigmentosa. You also see that the van is striking a U-turn sign, and this is reflecting the fact that Canavan's disease does not spare the U fibers. It extends all the way out to the cortex. Driving the van, we have Alexander. Alexander has a glowing halo around him, and he has a very large head. So this is reflecting Alexander's disease, which predominantly affects the frontal white matter. It is contrast enhancing, as seen by this glow, and Alexander's disease can cause macrocephaly. And you can see that Alexander's head is so big, it actually requires the head of the van to be enlarged. So this is also showing that Canavan's disease is associated with macrocephaly. The paint job of the van is filling most of the middle portion, and this reflects metachromatic leukodystrophy. Now you can see that the paint is falling off of the paint job, reflecting that metachromatic leukodystrophy can cause a demyelinating peripheral neuropathy. This paint job has stripes, reflecting that you can see a tiger stripe pattern with metachromatic leukodystrophy. And the white matter changes are predominantly seen in the central white matter throughout the brain, but it does spare the U fibers. In the middle, you can see that there is this circle reflecting that metachromatic leukodystrophy is a lysosomal storage disorder. In the middle of the van, we have crab with a halo and signs that he's moving very fast. So this is reflecting Krabbe's disease. With Krabbe's disease, you can see that there is a halo sign where you can have a pattern of band of hyperintensity. The crab is moving fast, reflecting that this is a rapidly progressive leukodystrophy, and it's within the circle showing that this is a lysosomal storage disorder. Now, Krabbe's disease predominantly affects the centralmost white matter of the brain, shown by the crab in the middle of the van. Towards the back, we have this adrenal gland that is glowing again, and it's associated with this gas pump. So this is showing an X-linked adrenoleukodystrophy, which the imaging pattern is in the posterior white matter. It is contrast enhancing. And X-linked adrenoleukodystrophy is associated with very long chain fatty acids. So we've talked through some of these details, and also in the image are little mnemonics to help us remember the associated genes. So for Canavan's disease, we see that there's an NAA, and this is reflecting the gene associated with Canavan's disease, which is N-acetyl aspartilase. Now the paint of the van just has the AA, which is reflecting aryl sulfatase A. Alexander has a GFAP on his shirt, reflecting the GFAP gene. The crab has a GC, reflecting galactocerebrosidase, and this kidney has ABCD1, which is reflecting the gene associated with metabolism of very long chain fatty acids. So this is the Alexander in his van 2.0 mnemonic.
Woo!